So much of what we talk about in EPIC is from TBRI, trust-based relational intervention. And a lot of that focus is on connection before correction, because the child will be way more willing to accept correction when they have a good relationship with you. Let me illustrate an example for you. Imagine that you just started working at a new job and you're just getting to know your boss or someone at this job, and they notice that you're doing something wrong, and they say something to you like, "Stop doing that," or "Don't do that," kind of in the same tone you would say to your child, even in the presence of others. How do you think you would respond to that? Do you think that that would provoke change? Let's talk about a second example where a really good friend you know cares about you comes to you and says, "I'm concerned for you, and this is why." And then they explain to you the potential consequences of what it is that you're doing. Which scenario do you think would work better? In what situation do you think you're more likely to change? We would argue that in TBRI, you're way more likely to respond to the second person who demonstrated care and concern for you well before they corrected you. And so we want to give you some tips on how to do this with your child. The first one is to use eye contact. We want to make sure we're at face-to-face level with the child and make sure that we can see their eyes. You can use things like, "Let me see your eyes," and you can even use symbolic touch by just putting your hand below their chin or even putting your hand on their chin if they feel comfortable with your touch. The second one is your tone, which is so important. It's really important to make sure that you know where your tone is at and that you're not screaming, because nobody really likes to be screamed at, and that doesn't help de-escalate the situation. The third one is to ask questions and don't assume, "What do you need?" or "What's going on?" Ask that before you assume what's going on so that you can really get to the bottom of where your child is at. And lastly, if you notice that the child is out of control, it's really important that you take a step back from that situation and just focus on their physical needs. Maybe they need a glass of water or some food, or maybe they need to just go for a walk or breathe. It would be really ideal if you could think about what are some things that have worked for them in the past and have those things ready for that kind of situation. And we like to just say that if you don't know much about the brain and how it functions when a person is in crisis, I would ask you to just go on YouTube and look up Dr. Dan Siegel's hand model of the brain. That will teach you a lot more about what we're talking about. The most important thing that we find is that connecting with your child is a big thing for them to want to accept correction from you. Anytime that you build the relationship, you are more likely to get a response from them. I have never seen a child that hasn't responded well to these things, and so I hope that they will be helpful to you. Happy parenting.